into the final and biggest weekend of the Mardi Gras season, and whether you are sidewalk side or neutral ground, you want to make sure you and your family and friends are safe and safe from injuries. Unfortunately, one of the most common injuries doctors see this time of year, concussions. Dr. Andrew Gottschalk from Ochsner Sports Medicine is here with us this morning. Good morning.
Thank you for having me.
All right, so, you know, sometimes the riders on the floats like to chuck these big old bags of beads at people. Do you find that emergency rooms around here, they are seeing people with head injuries from getting pelted with beads?
Yes, absolutely. And it's interesting because usually I'm asked to talk about concussions in the setting of sports, basketball concussions, football concussions, in some sort of sports setting. It turns out you can get a concussion anywhere. And hey, during Mardi Gras is a prime time to get concussions because maybe you hit your head on a ladder, or maybe you're going for a bag of beads or some heavy throw, or maybe somebody next to you who's going for a throw hits you in the head, accidentally going for that throw. So there's plenty of opportunities to hit your head during Mardi Gras, so it's a good time to talk about being safe. How
do you know if you do have a concussion or some sort of head injury, if you do get hit, or maybe if you fall, if you're walking up to a float or something, you fall off the curb? How do you know?
It's a good question because concussions can present in different ways. Far and away, the most likely symptom with a concussion is a headache. So if you get hit in the head and you have a headache, you might want to be thinking about that. But a concussion can present in any other types of ways, like visual disturbances, auditory disturbances. You might have a ringing in your ears, maybe nausea, maybe vomiting. A concussion can really be whatever it wants because the brain is having a hard time.
And how soon after you suffer, some sort of injury, would you start to feel these symptoms?
Great question. It can be right away. It can present a couple of hours later. Maybe even you wake up the next morning not knowing from an event the day before and you're having a hard time.
A lot of people would think, oh, I've just got a headache, I might have taken a little spill, I'll just take some Advil or Tylenol and be fine. Is that not a good thing to do?
With a concussion, no. I see every type of injury you can think of in my clinic, but I care more about your brain than any other part of the body. If you sprain your ankle and you want to wait a couple of days, that's fine. If you have a sore shoulder and you want to wait, that's fine. If we're talking about a brain injury, and concussion is mild traumatic brain injury, I care more about your brain than any other part of your body. If you have a question about the health of your brain, get help.
Okay, and if you're on the parade route, that means leave the parade route or potentially see a medical professional. I know New Orleans EMS has some tents set up, along the parade routes.
Exactly. So find help, find EMS. And again, we're talking about your brain. You might be out there, you might be having a good time, but if your brain health is in question, find a professional to help you out. That might be EMS on the route. You might want to go and call the Ochsner nurse line. Find somebody to answer those questions.
It's probably a good time to remind people to maybe just not indulge in as much alcohol as you'd like to make sure you're safe this
And I think that's true because we do want you to have fun. We want you to have fun safely.
Yeah, absolutely. All right, well, Dr. Gottschalk, thank you so much for being here. We appreciate it.
Thank you for having me.